On behalf of both the New York State Dental Foundation and the New York State Dental Association, I thank you for taking the time to join us today. And I'd also like to thank the American Dental Association for their generous support of today's webinar. We have a very full agenda, but at the end of this hour, I hope that each of you have a much better understanding of what the dental health certificate is and why it's so important. I'll be introducing each of our presenters as their piece of the agenda
has joined the conference.
I'm asking that we hold all questions till the end of the program. Right now, I'm very happy to introduce Dr. Michael Breaux, who's the NISDA president.
Thank you, Laura. A year ago, the New York State Dental Association helped to secure passage of legislation which requires public schools throughout New York State to request a dental health certificate from children entering certain grades. Finally, the importance
of the conference
to a child's overall well-being is being communicated to people outside the dental profession, and this is a good thing. As president of the New York State Dental Association, I am committed to ensuring the success of this legislation because I believe, at the end of the day, we will find that the children's dental health certificates, or assessments, as they are properly known, will become a requirement parallel to the student health appraisal, which designates physical well-being. I am committed to promoting opportunities for all New Yorkers to see a dentist and to recruiting New York State Dental Association members to participate in assessment and treatment programs within their own towns and districts. And I am particularly committed to seeking to close the access gap which exists in rural and underserved areas and which poses a particular risk to vulnerable children. Poor oral health affects more than just the mouth. It can have a profound negative impact on a child's general health, quality of life, and ability to attend school. It is estimated that nationally, 51 million school hours are lost each year due to children experiencing pain from existing oral health conditions. We, as a society, must address this serious problem, and the Dental Health Assessments Program is one vehicle through which we have the ability to make a difference. And so I thank you for attending today's webinar, and I hope that you will take away from it more understanding of what the law is, how it can be implemented in your own schools or programs, and how, working together,
has joined the conference.
Communicate the key fact that oral health is essential to general health and well-being at every stage of life. Thank you.
Yeah, I'd like to introduce Lawrence Mokhiber, who's the Acting Executive Secretary for the State Board for Dentistry, New York State Education Department, and James Hines, Assistant Counsel, Office of the Professions.
Good morning. The State Education Department and the New York State Board of Regents,
Clinton County, Derwent Facto, has joined the conference.
Through our Office of the Profession, Division of Elementary, Middle, and Secondary Education, we're very proud of the collaborative efforts with the Dental Association, our state schools, dentists, and others in promotion of this important health, safety, and welfare initiative. Clearly, this is a bright example of the benefits that can accrue when government and the professions collaborate. We hope that it is just the start of this, and we continue to promote this program as Jim and others will outline as we proceed. Thank you.
Yes, this is Jim Hines, and I just wanted to give an overview of the school's obligations with regard to the program. The education law was amended basically last year, effective September 1, 2008, to require all schools in New York to distribute a dental health certificate to each student. We're therefore in our second school year, approaching our second school year for the program, and we're hoping to ramp up
has joined the conference.
Participation in the program and awareness of the program. The law requires certain basic obligations for the schools. The schools are required to request that each student furnish a dental health certificate at the same time as health certificates are currently required. That is, after initial entry into a school and within 30 days of the student's entry into the 2nd, 4th, 7th, and 10th grades. It's important to note that there's no requirement in law that the student return the dental health certificate currently, and there's no obligation to keep a student out of school if the student fails to return the certificate. Basically, the obligation is the school furnishes their certificate. It's up to the student to return it. If the certificate's returned, it must be signed by a licensed dentist and describe the dental condition of the student and state whether the student is in fit condition of dental health to permit attendance at school. Must be based on an examination conducted within 12 months from the start of the school year. I also want to note that there's no obligation to keep a student out of school based on the results of the examination. as reflected by their certificate. The notice is distributed at the same time that the parents are notified of the general school health examination certificate. The notice states that a list of dentists to which students who need comprehensive dental examinations may be referred on a free or reduced cost basis is available upon request at the student's school. The Education Department, in collaboration with the Department of Health, will maintain a list of dentists to which students who need comprehensive dental examinations may be referred on a free or reduced cost basis. The comprehensive dental examination has been interpreted to mean an assessment performed by a dentist or a dental hygienist under the general supervision of a dentist, charting caries and periodontal conditions as an aid to diagnosis by the dentist, for the purpose of determining whether any painful conditions, obvious swelling related to clinical evidence of open cavities, or any other condition that interferes with a student's ability to chew, speak, or focus on school activity exists. The way this has been interpreted is that radiographs are not expected to be part of this assessment. Additional information on the role of the dentist in this process will be discussed by officials from the New York State Health Department. If the dental health certificate is returned by the student, it should be filed in the student's cumulative health record. We've developed a recommended certificate form, and it can be obtained at the Office of Professions Dental Board website, opnysed.gov/dentnews on our website. Now, turn it over to the Health Department.
Our next presenters are Dr. Jay Kumar from the New York State Department of Health. He's the Director of Surveillance and Research for the Bureau of Dental Health. And he's presenting with Anthony Pinocchio. He's with the New York State Department of Health. He is the school-based dental health coordinator.
Good morning. As was discussed earlier by the State Ed Department, students are required to furnish a dental health certificate upon entry.
Rebecca Sheehan has joined the conference.
Required to furnish a dental health certificate upon entry to school or entry into grades K, 2, or 7, and 10. Each certificate must be signed by a licensed dentist. However, please note, a licensed dental hygienist can perform the dental assessment. However, it must be signed by a licensed supervising dentist. The exam must be made no more than 12 months prior to the beginning of the school year. Next slide, please. This is a sample of the dental health certificate. It is divided into 3 sections, and we'll be discussing each section in greater detail separately. Although this is a sample document, we recommend that you use the same form. The form as it appears has been reviewed to ensure that it is consistent with the state ed law. The first section is to be completed by the parent or guardian, and the second section and the optional sections are to be completed by a licensed dentist. Next slide, please. Section 1 is to be completed by the parent or guardian, and it gathers information about the student and gets consent to have the assessment done. In the question, have you noticed any problems in the mouth that interfere with the child's ability to chew, speak, focus on school activities? Yes or no? This is a red flag, and it indicates possible problems that the child might be facing. In the consent line, consent is for the assessment only. We recommend that every student have a complete exam and x-rays. This consent limits the liability of dentists making the assessment by characterizing the doctor-patient relationship and following of recommendations. Next slide, please. Section 2 is to be completed by the dentist or a supervised dental hygienist. The dentist is the only person who can sign off on this document. If the student is a patient of record and has had a dental exam within 12 months of the school year, the form can be simply completed. If a dental assessment determines that a student is not in fit condition of dental health, this does not mean that the student is not allowed to go back to school. In fact, the student can return to school. However, we strongly recommend that at this point you recommend the child see a dental professional and seek treatment. Next slide, please. In this optional section, it provides us with very valuable data, and we highly recommend that it is completed. It discusses whether a child has had any caries experience, if they have any untreated cavities, and if they've had dental sealants and dental sealants are present. It also asks if treatment is required, and there's a checkoff box for that. This section promotes real good oral health for the child. Next section, please. What should dentists know about school dental health certificates? And what if a student is not in fit condition to attend school? As it was mentioned earlier, this does not mean the child cannot attend school. It just means that the child needs to seek some
Holly Barone
has joined the conference.
What should a school do with the dental health certificates? Well, it's a good idea for the school nurse to review this section, and it provides an opportunity to provide good oral health and work with the child's family to get this child the needed dental care that they need. Once that's done, it should be filed into the cumulative health record. Next slide. What should your office do when a patient calls opting to provide the school with the dental health certificate? If the child is already a patient of record and has had an examination within the last 12 months, the results of that examination can be used to fill out the dental health certificate form. Slide, please. What should your office do when someone calls requesting a dental health certificate for their child's school, and this is the first time the caller has contacted your office? Ideally, all children should receive a comprehensive exam in your office. Many factors figure into the parent's decision to schedule the recommended examination appointment. It's very important that you discuss insurance coverage and what is covered, expectations of an assessment and what is in store for the child, and clearly explain the fees that are associated with it and the possibility of a need for a comprehensive exam, x-rays, and treatment is so deemed necessary. Next slide, please. If the caller does not want to schedule a comprehensive exam for their child, what is the next step? Well, consider the assessment and counseling as a free service for the family. If you choose to do the free assessment rather than a comprehensive exam that your office offers, be very clear when the appointment is established that you will be conducting only an assessment and no charge is for that service. Parents should be allowed to make a fully informed decision. Next slide, please. What if I get a call from a school to help them conduct dental health assessments? Well, if that happens, we strongly encourage you to take the opportunity to volunteer to conduct the screenings, and we also recommend that you also promote the good oral health of the kids, and you get your colleagues to help volunteer as well. Next slide, please. Participate in the program. Offer your assistance to schools. Consider listing your names with the school as the school dentist, and as mentioned earlier, recruit your colleagues. Promote good oral health throughout the state of New York. Next slide. A little bit about the school-based health center dental delivery methods. Currently, we have about 38 Article 28 providers in the state of New York that work in about 550 schools throughout the state. They provide a wide range of services, including dental assessments, comprehensive exams, x-rays, prophies, sealants, and restorative and extractive procedures. There are about 3 different methods that are used in the state right now. We have portable dental equipment, mobile dental vans, and fixed schools.
Rebecca Sheehan
has left the conference.
And you'll be hearing about some of these examples later on in the webinar.
Thank you, Tony. Our next presentation is by Rita Malloy. She is past president of the New York State Association of School Nurses. Are you there, Rita? We're going to find Rita, and right now we're going to skip ahead. We'll come back to Rita as soon as we can locate her. Do I have Jody Lucas on the phone? Is she there? We're going to talk about a little bit about what's being done out there already Judy Lucas is the dental case management person for Medicaid Managed Care at Tompkins County Department of Social Services. And they have a really great case management program, which is an example of things that are existing and that could be replicated in other parts of the state. We've lost Judy, too. I apologize. We're going to get them back on. Is Sue Medina on the webinar? My goodness. Okay. What we're going to do right now, if there's anybody who has a question, let me see what's happened with some of our presenters. If anybody has a question, I would suggest that we take a few questions now while I just try to figure out what the technical problem is.
Has joined the conference.
I had one question right there. One of the questions that we often get is, what exactly is the dental health assessment? What exactly is entailed in that? And as we've said already, it doesn't include x-rays, but Dr. Milton Loney perhaps would like to explain that.
I'm Dr. Milton Loney. I am a consultant with the New York State Dental Foundation, and basically what we call an assessment is a quick, and I don't want to use the term quick, but a very brief caries review to see if there's any open visible disease within the mouth. And that is one of the basic things that we look at when you do an assessment. It's also, radiographs are not part of the assessment, and it should always be recommended again that a complete and total comprehensive dental exam be done if so indicated. Joseph, are there any other questions on mine?
Actually, at this time, Dr. Loney, we do have Rita Malloy here from the New York State Association of School Nurses. And Rita's just going to fill us in with regards to the role that school nurses play in dental health and in promoting this new certificate.
Well, I appreciate the opportunity to speak to people about the important role that school nurses play as advocates for dental health in schools. As a school nurse, we are uniquely positioned to observe children for health-related issues and to make timely referrals. Early access to dental care promotes the overall health and well-being of students, which helps to enhance educational outcomes. The dental health certificates are now requested at intervals that physical examinations are required for new school entrants in grades K, 2, 4, 7, and 10. The referrals need documentation of follow-up treatment. So it's important for a school nurse to look at every certificate that comes in to see if there's ongoing care required and to try to make determination that follow-up is being concluded. And it creates an opportunity for the school nurse to have a dialogue about the important role that dental care plays in the overall health and well-being of each student. Many parents may not be aware that the primary teeth need professional dental care, and early intervention will set the stage for good oral health over a child's lifetime. Tooth eruption may be a cause for visits to the health office and a good time to engage in a dialogue about good oral health. So it's important, again, to take the time to talk to and listen to the parents and caregivers about the child's overall health needs, and certainly dental health is one of those. One of the unique things that happens in schools as well is we have the opportunity to assess children for injuries related to sports and playground activities. And being a setting that's very active, we see an increased risk for injuries to present to the oral cavity. So it's important that dental referrals should be made for any injuries that increase the chance of damage to the teeth or the oral cavity itself. And in schools, there should be first aid interventions for dental emergencies that are planned for in advance and addressed by school protocols. Each school may have a unique guideline set up to deal with the emergencies, and the recommendations should be consistent with the current guidelines and updated as needed. And if the tooth is broken or avulsed, the student and the tooth should be taken to a dentist immediately. more and more now we are seeing special needs children included in all school settings. And special needs children may have predispositions to different dental health care concerns. They may be predisposed to a change in oral development or infection. Their tooth eruption may be delayed or accelerated. Malocclusion, porphyria crowding, and bruxism may be associated with intellectual development or disability. For instance, children with Down syndrome may have delayed tooth eruption. Children with cerebral palsy may have a pattern of grinding their teeth, and this may really impact on their overall ability to do well orally. So it's, again, something that you want to take a good health history and make sure that you understand the different problems that that individual child is having and create a plan of care to help to address any needs that they might have. Tooth anomalies may affect the eating patterns, and the developmental defects may predispose them to dental caries. For instance, if you have crowding, they may have many more reasons to have caries because getting in those spaces may be difficult to appropriately cleanse the tooth surfaces. And school nurses are case managers for all of their students to facilitate health and wellness. So when we look to pull together parents, children, and the community, we promote the best outcomes that we can for health. And the New York State Association of School Nurses has been working collaboratively with the New York State Dental Association to promote optimal educational outcomes for students to enhance their success. And when academic success is achieved, it's our goal. So partnerships that are forged with school nurses and their clients, the dental and medical communities at large, all works to create a medical home that is comprehensive and helps to promote improved educational outcomes for all of our children. One of the things that I'd like to point out is that if people go to the New York State Association of School Nurses website, which is nysasn.org, we've had posted a free tutorial that the American Academy of Pediatrics has provided for people to learn more about dental health. And it's a comprehensive module. It's about, I think, 16 different types of subject matter. So please do check that out, and if there are any questions, I'd be happy to answer them.
Okay. Thank you very much, Rita. We were having a little bit of technical difficulty with two of our presenters. Is that been involved? Okay. What I'm going to do right now is we're going to go back to the Tompkins County Dental Case Management Program. Tony, are you still on the line?
Yes, I am.
Would you be able to talk a little bit about that one?
Sure.
Thank you.
Laura, I'm here.
Hi, Jay.
Is Jody joining in, or?
She's on, but apparently the audio on her end, somebody's having some difficulty. So that's why I'm asking if
okay. I'm Jay Kumar. I'm from the New York State Department of Health. This particular program is a grant program funded by the New York State Department of Health. It started about 5 years ago, and the county applied to the State Health Department requesting funds to start a case management program. I believe they had examined other models like a mobile van or a fixed clinic, but they wanted to use the existing capacity in Tompkins County to increase access to dental care. So some of the services are listed here. The goal was to assist low-income families in finding a local dental home. And the services that the case management program offers are screening, education, and counseling of clients, and matching clients to sites nearest to their homes. In other words, to link the family to a dentist or a dental office. And then to review Medicaid claims history to ensure eligibility for services, and to coordinate Medicaid transportation, and to reach out to pregnant women, young children, and children with special care needs
primarily because these groups of patients tend to not go and visit the dentist for different reasons. Next slide, please. So another aspect of this program is to recruit dentists to participate in the program, primarily in Medicaid and other public insurance programs. Some of the services provided are, training, technical assistance, and support for practices with electronic and paper billing. And also to verify Medicaid eligibility prior to appointments, and provide participating practices with a roster of claims in the program. Medicaid provider enrollment assistance is also included as part of this program.
And partner has joined the conference.
And the program also maintains a database of participating providers and also recipients. And when necessary, staff visit dental offices to provide technical assistance, and also they attend dental society meetings to promote the program. And there are outreach materials available to both to providers and also to clients. And there is a telephone contact that patients can call and get information. Next slide, please. So it is located in the Department of Social Services. It's a very convenient place for clients to visit. And it's one of the few organizations that can provide all the services that are essential to improving access to dental care for Medicaid population because the eligibility is determined and also claims history is reviewed, and billing assistance and support are provided in addition to transportation coordination. So far, the program has 1,217 individuals enrolled in the program. So this is in a summary of the Tompkins County Case Management Program. Thank you.
Thanks for pinch hitting there. I really appreciate it. Right now we're going to talk a little bit about the Tioga Mobile Dental Services Program. Again, an example of something that's working really, really well that can provide services and could possibly be replicated in other parts of the state. I don't have Sim Medina right now, but I do have Milton Lonnie, DDS. He is our public advocacy coordinator, and he's very, very familiar with this particular program. So Milt is going to talk about this.
I had the pleasure of visiting the Tioga Mobile Dental Service about a month ago, and they really do have an outstanding program. Basically, the van was started about 2002, 2003, and they got initial funding through a small city grant. Tioga County is a rural area, and what they needed was to serve the schools and their community throughout the rural area, and they chose to go the route of a dental van, which is basically a dental office on wheels. It is two-operatory. For the non-dentist, that means there are two rooms where treatment is provided. One is a dental treatment room, and one is a hygiene room where a hygienist provides services. The dental van also has a full complement of x-ray machines. The van does travel Tioga County. It locates itself at the county schools, and it basically focuses on individuals without access to care. They provide preventive and restorative care. The preventive care is sealants and treatment, fluoride treatments, and the restorative care is basically restorations and other, which can vary from amalgam fillings or white fillings to extractions where necessary. Currently, they have treated over 5,000 patients. How does this work? Tioga County Health Department and each individual school administrator agree upon and sign a memorandum of understanding. The enrollment packets are given to the parents, which authorize initial appointments. A treatment plan is developed and an informed consent is sent home to be signed. Restorative care is provided once signed informed consent is received. The Tioga Dental Services, and why it does work and why it is successful is that it has a supportive school personnel and administration, and it does provide the community a service. The van is fully supported by the Tioga County Health Department and Tioga County Legislature. This is evidence that shows that there can be a collaboration between the dental community, schools, and the county legislature. When I visited Tioga County to present an award from the New York State Dental Foundation, there were at least 30 community leaders that attended the presentation, and this ranged from the superintendent of schools to representatives from Tioga County and the Tioga County Health Department. So the van does have the full support of the community and provides a valuable resource to that community. Thank you.
Thank you, Mel. The next slide just lists some of the resources that are available now to find more information as it develops. These are very timely, very up to date. There's also going to be a website appearing very soon. It's being administered, it's actually being developed right now, but will be administered by the Rochester Technical Assistance Center. As soon as we know the name of that website, we will let you all know. But that will be the official go-to place for anything related to the dental health certificate. If anybody has questions about the program, about what we're trying to do, I encourage you to contact Dr. Lonnie. There's a sheet there. There's a slide that gives you his contact information. He's been working for the last year on our efforts to try to promote this across the state. So I would encourage you to talk to him. At this point, I wanted to see if anybody has any questions regarding anything we've talked about or anything that we've missed out. I do know one of the questions we've received is what happens if a student is deemed unfit. I know that Jim mentioned that. There's nothing in this program that precludes that child from going back to school. The point of this program is not to be negative. It's really trying to identify those children out there who do have some problems that are affecting their overall health and well-being, and hopefully to try to get those children into treatment that they need.
Laura?
Yes?
This is Dr. Seaver, Jeff Seaver.
Hey,
I do have a question, if I may, regarding the Tompkins program.
Okay.
I noticed on the slide it said there was, and I just want to give a little background on myself. I'm from Suffolk County Dental Society, and I'm the chairman of their Access to Care program, and this has been an excellent presentation from my point of view so far. And I was just curious to know, I noticed one of the slides did mention that there was about, if I'm not mistaken, 1,200 children involved currently in the program, but it didn't mention how many participating providers they have to see that amount of people. Do we have any figures on how many participating providers they have?
This is Jay Kumar. I can answer that question. Actually, I think you are referring to the Tompkins County Case Management Program.
That is correct.
Okay. We have a publication in the Journal of the American Dental Association. It provides more information about the number of children served, number of providers. When we published the data, we had 22 providers enrolled in the program. And the increase from 2 providers prior to the case management program to 22. So a dramatic improvement in the number of providers enrolled in the Medicaid program.
Excuse me, I don't mean to interrupt. I'm from Tompkins County, and we had a bit of a technical difficulty getting on this morning.
Oh, okay.
I just wanted to speak to the amount of people we have enrolled. We have 1,217 total participants enrolled as far as clients or customers. That wasn't all children. But as far as dental providers in our county, we have 34.
So it increased from the last count that we had.
Thank you.
Thank you.
This is Dr. Lonnie, and I'm going to answer a question that was sent in. And the question is, does a dentist, he or she provides an assessment will they have a legal obligation to provide follow-up care? I want to get back to the dental health certificate form slide. I don't know if we're able to get back to it, but it's the slide with section 1. And this is why it's important that we highly recommend that the approved, and what I mean by approved, a form that is on the state webpage be used, the dental health certificate form. On that slide, I will read you the language that is part of the consent. It's the second paragraph. I also understand that receiving this preliminary oral health assessment, and this is signed by the parent or guardian, does not establish any new, ongoing, or continuing doctor-patient relationships. Further, I will not hold the dentist or those performing this assessment responsible for the consequences or results should I choose not to follow the recommendations listed below. I think that language very adequately addresses the liability issue. So again, we would recommend highly that the dental health certificate form that you can obtain off the Office of the Profession webpage be used. Thank you.
Could I speak to that as well? I think it's important from a school nurse perspective, however, that when you read that a child needs ongoing follow-up, and as much as it is not the responsibility of the examining dentist, it is the responsibility of the parent to see that their child's health needs are met. And I've actually had a case in my own office where a child presented very frequently in very extreme pain, and the parents, despite all of our best efforts to provide every service available in our community, refused to follow and get that care for her child, and we did pursue that as medical neglect, and it was founded. So I just want to say that there is, still that responsibility to your client if you're the school nurse and you see that that child's in need of care, to do something and not just allow that to continue, just like with any other medical condition.
Thank you. We did have a question about whether the foundation is doing anything to encourage dentists across the state to provide the assessment at free or reduced rates. This is one of our ongoing projects. We do encourage dentists. That's a part of our ADA grant. We're trying to get as many dentists as possible involved in this effort so that every section of the state has some people that are out there, maybe adopting a school, becoming a school dentist, doing group assessments within their local component dental societies. There's a number of ways that a dentist can participate in this program, and we encourage dentists to contact their local dental societies, see what's already in place. I know Dr. Seaver mentioned his program in Suffolk County, which is a very really a model program. I think we should have had you talk about it. Actually, we might have you talk about it.
I'd be more than happy.
And, just not so much reinventing the wheel. There are a lot of really good programs out there. There are a lot of simple ways where dentists can get involved and try to treat these children.
Has left the conference.
Jeff, did you want to say a couple words about the Suffolk County program? Because it really is a jewel.
Sure, Laura, I'd be more than happy. In Suffolk County, we started an Access to Care program approximately a year and a half ago. We started up a pilot program and enlisted approximately 50 member dentists in Suffolk County. Not just general practitioners, but we have of all specialty groups. Our program is open not only to children, but also adults. We do have a helping agency in our area that screens all participants, and we have very loose criteria. It's those patients that don't have access to dental care, usually because of financial means. But it's not just limited to those that have places to turn to for services like Medicaid. Those patients that fit into those parameters, the helping agency, Family Service League, then helps that client get the necessary services so that they can get the care that they need. Our group looks more towards the working poor, so it's those patients or prospective patients that fall through the cracks. They make too much money to get state services, but not enough money to get the needed care. They live paycheck to paycheck, basically. Our program, I don't have the total figures of how many participants there are in the last year and a half. Like I said, we have about 50 and volunteers, and we do incorporate the ADA's program, Give Kids a Smile, in the month of February with our program. So we've screened, last year we screened about 1,000 children through 3 areas in Suffolk County. We're fortunate enough to have Farmingdale University, Stony Brook University, and St. Charles Hospital. And we set up those 3 locations to screen patients. And we do a little more than screening at those locations because we're able to have the facilities to do more. But during that time, every child gets a dental health certificate signed. And what we do is we take the names with the permission of the parents and get those names over to Family Service League to screen these children to try to get them either
has joined the conference.
Services through the state if it warrants, or B, if they fall into our parameters, to get those children who have been identified with carious lesions into a volunteer's office to get those services rendered. And we haven't had any dropouts in any participants.
Has joined the conference.
And I think, Laura, our biggest problem is our fear of opening it up island-wide in Suffolk County because we don't want to scare off our participating providers. And I think that's our major concern at this point. But I think what you've presented here is an excellent start, and I would like to see a program like this.
Chris Chalotnicki
has left the conference.
Thank you, Laura.
Thank you very much, Jeff. We have a question. Actually, Sue Medina, welcome to the webinar. I'm glad that you made it. We have a question that actually is specific to your program. And the question is, are the parents present when the children are seen on the Tioga Mobile Service van, or do they return the form to the schools without a parent signature?
What we have is informed consent that the parents sign and agree to any treatment that's needed. And if they choose to come to the visit, they're more than welcome, but in most cases they choose not to. So there is like a signed consent, though, before we do anything.
All right, so we have one more question.
Dr. Lonnie again. We have a question coming in. What is one of the overall purposes of the school dental health certificate? There's a new terminology in the medical and dental world, and it's referred to as a home for a child. We're seeing children that may be lacking in medical care or dental care, and what we're trying to find them is a dental home, at least a beginning point where they can access or find or get information about treatment. And we're finding that in dentistry, and we're hopeful that the school health certificate, as they grow, will be the beginning point to find dental homes. And that is why this legislation has been so important, and it's being so well endorsed by the American Dental Association, the New York State Dental Association, the Foundation, and many other stakeholders to make it successful so we can get these children a dental home. Thank you.
All right. Well, this concludes our session. I, again, want to thank you all for joining us. I hope that you are taking away something that is going to help you going forward in your own
has left the conference.
And I just want to stress that this is the beginning of a process. This law has only been in effect for about a year, and we're still learning things. We're we and all of our partners are still trying to get the hang of various issues and how to respond. But overall, the key thing that we keep stressing is that this is about the children. This is about making that link between oral health and general well-being, which we know now is very significant and very vital. So again, thank you so much for appearing, for being with us. And if you have any questions, please feel free to call us at 800-255-2100. I want to send a special thank you to all of our presenters who took time today, especially our friends at the Department of Health, Dental Bureau, State Ed, School Nurses Association, Tompkins County, and Tioga. If I left out anybody, I'm sorry, but thank you very much.
Clinton County, Derwin Facto has left the conference.
Tony Pinocchio.
Has left the conference.
Hallie Barone.
Has left the conference.
Barbara Greenberg.
Has left the conference.
Jeff Seaver.
Has left the conference.
Amy Malloy.
Has left the conference.
New York State Dental Foundation?
Has left the conference.
Diane McGrainer.
Has left the conference.